Each year, over 350,000 people experience cardiac arrest outside of a hospital, with only 10% surviving due to lack of timely CPR. That's per the American Heart Association website. In the event of someone suffering cardiac arrest, CPR or cardiopulmonary resuscitation can be and should be provided to help kick the heart back into action or help keep blood moving throughout the body until further help from professionals can do more definitive care. Today we'll be discussing the benefits of knowing CPR and providing a visual aid on adult and pediatric/infant CPR. This could one day be of use of you in the event that you witness a loved one or even a stranger have cardiac arrest and require CPR. My name is Jaron. I've worked as an emergency medical technician for 3 years in Springfield, Mass., and I am now operating as a firefighter in Springfield, Mass. I've done CPR more times than I can remember, and it oftentimes just comes out of nowhere. 1 minute you're talking to somebody, and the next minute, boom, they're in cardiac arrest and they require CPR. To understand this topic, it is important that we discuss what cardiac arrest is, how to recognize it, and how CPR helps. What steps could be done to help someone in cardiac arrest, along with the difference between adult and pediatric/infant cardiac arrest and CPR. Let's begin by discussing what cardiac arrest is and how to recognize it. What is cardiac arrest? How can you recognize it? And how can CPR help you? Cardiac, in simpler terms, is your heart. The arrest of your heart is your heart stops beating. Your heart is your primary organ in the body. Once your heart stops beating and working properly, then the rest of your body shuts down and begins the process of dying. You can recognize if someone is in cardiac arrest in 3 simple steps. Try to talk to them and shake them slightly, or provide a painful stimulus to see if they react. So grab your knuckles, rub them across their chest like this, see if they groan or anything like that. Assess breathing by looking for a chest rise and fall. When you breathe, your chest expands and then it compresses. That's your lungs expanding and compressing. And then you are going to assess for a carotid pulse on the carotid artery. So that's right there. And I'm going to be demonstrating all this during the presentation aspect. Early CPR could double or triple the chances of survival after cardiac arrest. That is per the American Heart Association. What steps could be done when someone is in cardiac arrest? When you've confirmed someone is in cardiac arrest, immediately tell someone to call 911 and retrieve an AED or an automatic external defibrillator. This is an important first step because eventually the person will need professional help and definitive care. Then begin compressions going about 1/3 the depth of the chest, doing repetitions of 30 compressions to 2 rescue breaths for adults and adolescents. For pediatric CPR, you are going to be doing 30 reps to 2 rescue breaths. And for infants, you're going to be doing 15 reps and then 2 rescue breaths until help arrives. Now I'm going to be demonstrating that process. We're going to be starting off with adult CPR. I'm going to be using this adult dummy for both adult, adolescent, and pediatric CPR. So adult and adolescent CPR and pediatric is the same. So first you're going to shake them, see if they're okay. Hello, are you okay? Are you okay? Provide a little painful stimulus. There's no reaction. I'm going to assess for chest rise and fall. There is none. I'm going to assess for a carotid pulse on the carotid artery. I do not feel one. Now I'm going to begin CPR process. Call 911. Retrieve an AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So for rescue breaths, if it's a loved one or someone that you deeply care about, like your spouse or your child, then I would suggest doing mouth-to-mouth on a stranger. Don't do mouth-to-mouth. When you're doing compressions, you want to keep your arms straight, your elbows locked, and you're going to be using the force of your body to push down. Yes, you are going to break ribs. It does happen. Broken ribs can be fixed. That's not an issue. Now I'm going to be demonstrating infant CPR. You're going to take a knee. You're going to put the baby in between your arm like this. You're going to be using 2 fingers. You're going to be pushing down in the center of their chest for 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And that is the demonstration process. We're going to be discussing what the difference between adult and pediatric/infant cardiac arrest and CPR is. Oftentimes, pediatric and infant cardiac arrest is a result of a respiratory issue. Most commonly, there's an obstruction in their airway. Could be blocks, toys, crayons, food, etc. Meaning their CPR process is a little bit different. So for infants, it is standard after providing compressions, you do 5 back blows to move the obstruction up and out of the airway. I'm going to be demonstrating that right now. So you have your infant right here. You're going to resume that position you're in. 1, 2, 3, 4, 5. And then you're going to flip over to the other knee, having the baby's back exposed like this with their head down. And you're going to 1, 2, 3, 4, 5. I know it may seem gruesome, but a bruised baby is better than a dead baby. And it's crude to say, but that's the reality of the situation. So, adult CPR could be a number of things. It could be cardiac related or respiratory related. CPR for an adult would just consist of doing the compressions and the breaths for them. Today, we learned about cardiac arrest and CPR. First, we discussed what exactly cardiac arrest is, how you can recognize it, and how CPR helps. Then, we discussed what steps should be done in the event someone is in cardiac arrest. Then we ended off with the difference between adult, pediatric, and infant CPR and cardiac arrest. The information you learned today is just the tip of the iceberg. I would highly urge everyone to take a CPR course and receive their certification for CPR. You could one day use the information to save someone's life, whether it be a stranger or a loved one. Thank you.